Welcome to the Beverly Hills Plastic Surgery Podcast. I'm Dr. Jay Calvert, here today in a new studio with my always willing to be flexible co-host, Dr. Millicent Rovelo. How are you doing?
I'm doing wonderful. I'm loving our new little space. It's temporary. We're in the middle of a little podcast studio flux, but I'm digging it. I'm liking this one.
Yeah, it's really nice. We're happy to be here. So, shout out to Melrose Podcast Studios. I think that's where we are. And, of course, I do want to note that we are literally 50 yards from the body shop. So on Sunset.
Which is not, as you might think, an auto body shop.
No,
it's the other kind of body shop. Use your imagination.
I also want to note I've never been there. So I'm never. I don't even know what goes on in there. So
I think I've been there.
I think you've been there more than I have, which is good. But I have had patients from there back in the day. I no longer do. Anyway, we are here to talk today about breast reductions.
Yes. So
why are we doing that? Because this was your gig. Tell me what's up. This is like a thing,
right? So a New York Times article actually came out this week, and it was super interesting. And it was a very lengthy, very in-depth article about why so many women are having breast reductions since 2019. So over the past 5 years, there's been a over 60% increase in the number of women getting breast reductions, which is huge. And the article goes through different reasons why women are getting breast reductions and what the trends are and why this is happening. So I kind of wanted to delve into the reasons that women are getting breast reductions in increasing numbers. We have a ton of podcasts out there about how to do a breast reduction, the techniques of breast reduction, the recovery, the expectations. So feel free to please go and reference those for like the nitty-gritty surgical details. But for this one, I really just wanted to focus on the why. Why is this happening so much now?
It is a good question. The implant sizes that I put in now are much smaller. There's a lot of downsizing. I know. Hard to believe.
Whoa.
I know. Yes, I am Dr. Jay Calvert, and I approve this message.
So instead of 800s, we're doing like 657s?
Quan once asked me, Ed Quan, who is my fellow, he said, you only need 600 cc implants. Why do you even have a consignment with other sizes? But I will say this. I think there's a trend towards a more athletic body. I think there's smaller, tighter, more sculpted. That seems to be the trend lately. Now things change. Obviously, 3-4 years ago, everybody was trying to put as much fat as they could into their butt and get big implants to go with it. That's changing. I don't know how the BBL business is lately, but I would do my skinny BBLs. I haven't done one in quite some time.
Yeah, and that's part of the thing, is that over time, body trends, it's trends, things change. Think back to the 80s, you had athletic women with breast implants. And then in the 90s, we transitioned into kind of heroin chic and everyone was super wafy. And then as we got into the 2000s.
Heroin chic?
Yeah, that's a thing. That's a term.
I've never heard that.
Yeah, heroin chic.
I love that. Because that's really what it was.
It's the models who weigh like 90 pounds and look like little girls with big heads. Love you, Kate Moss. Love you. But then you come into the 2000s and you start getting into the Kardashian era. And this is when really curvy, voluptuous bodies came back into fashion. And were really heralded because it was a nice change from that heroin chic, super skinny, anorexic look. And, body positivity and curviness. And that went along with the larger butts and even bigger breast implants. And so now what we're seeing is sort of a return to smaller breasts. And that does include smaller implants, but also really specifically breast reductions. So women that have never had implants and have large breasts or large for them breasts, getting them smaller. And there's many reasons why this is happening. And one of them is for the same reason that women have been getting breast reduction for decades. They have really large breasts and they're having symptoms from them. And they need to have them reduced. They need to have them made smaller. And I think more women are doing that out of a symptomatic reason because insurance is getting a little bit easier to cover them. It used to be super, super stringent restrictions. And even I have noticed over the past few years, insurance is approving a little bit more than they used to. So I think more women are getting covered from an insurance standpoint when they have really large breasts and really need them reduced. And also I think getting the education out there to patients through social media, women sharing their stories about therapeutic breast reductions, Facebook pages about breast reductions, it's becoming more common and less of a scary thing for women to undergo.
Yeah, I definitely agree with you. I don't do a ton of reductions, probably, maybe 20 a year, which is, not nothing, but at the same time where I'm doing just an isolated reduction, it's pretty rare. Whereas doing a lift and implants and downsizing has become very common in my practice, where, my patients are kind of in my age range. That's the bulk of my patients are 45 to 60 years old because of my age. So they are at that age where they're saying, I love my implants, but I just want them smaller. And then can you do a lift around it, which is probably my most common breast operation, of which I probably do maybe, 50 of those a year. And so that's really more of what's happening in my world. But you are the breast reduction queen. I mean, there are days where you have 8 breast reduction consults in a row, and they're all there because of your artistry, obviously, with the breast reduction. But I think it's also I don't know, it just becomes when you get known for something, then people come for it. So
right, yeah, I do a ton of these. And what I have noticed over the past 3 years or so, and which this article highlighted and I thought was really important and interesting, is that we're seeing a trend to, as one of my patients call, and as they're known in the community, the IBTCs, the itty bitty titty community, itty bitty titty committee, is actually
I think that was something we had in middle school.
Oh, it's a thing now. It's trending again.
No, it's like it's a thing.
Yeah.
That's funny.
The itty bitty titty committee. These are women who maybe they don't have super large breasts. They have large for them breasts, and they want them really small. And every inspo photo that these women bring in are women that they find on TikTok, on Instagram, that have sort of an athletic body, not necessarily skinny, but fit. And they're usually wearing some kind of tank top with no bra. And they have these perfect, perky, like smallish to small medium breasts. And it is, in that sense, kind of a trend in the way that we discussed body sizes changing over the decades. I think the new decade trend that we're seeing, especially among the Gen Zers and the younger millennials, is this desire to have sort of a fit upper body. Mm-hmm. They call them yoga boobs, like the kind of boobs you can wear out without necessarily having to put a sports bra on and just put on your like yoga top, or not have to wear a bra when you put on your tube top or a sundress. So that is in the same sense that big implants and big breasts and big butts were a trend. I think we're seeing these small athletic breasts in some ways being a bit of a trend as well.
Yeah, I mean, I have a ton of fitness model patients. This is like a section of my practice that is, I guess it's kind of one of my things. They are still asking for sort of bigger implants. And I'm not sure why, but these are very athletic women. And so they're not coming in for, breast reductions at all. These are very sort of thin, fit women that still want to have, big implants. But, obviously that's not a breast reduction topic, but it's just in terms of the body image. I'm still seeing that there is a role for the larger implants, which is
absolutely. This is not one or the other. Breast augmentation is still the second most common surgery that we do. And everyone has a preference, everyone has a range. And the kind of body type that you're talking about is that super uber fit fitness model that tends to go along with larger implants. But then there's also that yoga body where big implants get in the way. Like you want to be able to be your sleek, athletic person. And so there's no right or wrong answer to this. It's very much preference.
100%.
And so in the sense that it's a trend, and I'm sure we'll see it
the other direction.
Swing back again in another 10, 15 years.
That was good.
But that's
nice one there.
Yeah, right.
You
like that?
They will swing back when they're.
They swing.
But this, so breast reductions have always been common. I mean, this is like a plastic surgical staple procedure. It is actually the highest satisfaction plastic surgery operation.
By far.
The patients who get breast reductions love their results. It is extremely common for people to be over the moon with their breast reductions, even though there's scars, et cetera. There's a lot of ways to do these operations. But even with all that, they're very happy that they reduce the size of their breasts, especially when they are very symptomatic. There's the cosmetic breast reduction, and then there's we're treating a medical problem breast reduction, which is probably more of what you do. I know you do both.
I do both, and both can be true, because for the large-breasted, symptomatic patient, they also still want their breasts to look really nice.
Definitely.
So there is definitely a cosmetic component to it. And so it's a spectrum. It's not just I need it for therapeutic reasons or I need it for cosmetic reasons. And actually what I typically get, if anything, like I can count maybe on one hand, I can think of the patients in my mind that wished they had been a little bit bigger after their breast reduction. Everyone else is either super happy or wish they were even a little bit smaller. So I can rarely get patients as small as they want to be. And that's the other component to this, because some of these patients do come in and they show me these yoga bodies with these tiny, small little boobs and say, I want to be this size. And I say, I will get you as close to that as possible. But not every boob and not every person is designed to be that, IBTC. So you have to work with what breasts you've been given and the overall size of your body. Because it's not like you can just go in and scoop out as much breast tissue as you want, close it up, and say you have small boobs. You have to preserve the blood supply to the nipple. You have to make sure that the breast you are left with still has a pretty shape. And if you were trying to take a person with a very wide breast and make it into this tiny little breast, if you do that, you can distort the shape of it, and then it really doesn't look pretty. So there are some limitations to how small you can get a breast, and maybe sometimes you have to do it in stages if you're really trying to go
100%.
Super small,
Yes.
give the skin time to contract. But I think smaller is definitely where people are going in terms of their preference.
Any new frontiers in terms of how to manage the scars? I know that your scars and the way that you do these operations, you're meticulous, the care that you take to suture everything. What are you doing now, Dr. Millicent Rovelo, to make these scars as minimal as possible? Because this is a stopper for a lot of women.
It's a lot. And there are the standard things that we do for all scars. So at 3 weeks, we start suggesting silicone gels, silicone strips. We have a whole variety of lasers that you can start doing at around 3 or 4 weeks to help with the pigmentation. You have microneedling that you can do to help with the texture. And then there are even some closure devices that you can use at the time of surgery that take some of the tension off of the incisions. So these are all things that you sort of have to do in tandem, in combination, or all together. Although the new thing that I have noticed and that I'm now really driving home with my patients.
You drive home with your patients?
I do.
That's nice
I'm
of
really
you.
Close with
That's
them,
that is super, super responsible care by your surgeon.
Thank you.
Thank you, Dr. Rovelo. I'm sure they appreciate it. What are you driving home with your patients?
What do I drive home?
Sorry.
A lot of these patients, for the first time in their lives, don't have to wear a bra. And so a few of them go a little crazy with that. And so they want to...
It's not good for the scars.
It's not good for the scars. That was my punchline.
Oh, sorry.
Rewind.
You know what? You should just kick me off this podcast right now. Like I'm ruining all your stuff.
I know.
Sorry.
No, so
it's not good for the scars.
It's not good for the
you
scars.
have to wear a bra.
You have to wear a bra. And so, but that's the thing, right? Because they brought me
Cat's out of
these
the bag.
photos of the TikTokers that have the tank tops on and the no bra and the nipples showing and these cute perky breasts. And yes, you will probably be able to do some version of that after your surgery. But if you do that every day and every night, not only do the breasts themselves sag, but especially in the beginning while those scars are still maturing, you stretch the scars out, and the scars around the areola, the circle part of the nipple, they get stretched out because gravity's pulling on them. Like that's just the nature of physics and gravity. So I really want my patients to wear bras 24/7 as much as possible for like this at least 6 months. Yes, there's gonna be nights, there's gonna be evenings, there's gonna be outfits when you don't want to wear a bra. Totally fine. But on a regular basis, just let them like hang out, not ideal.
What about sleeping in a bra? I mean, there are
Yes.
so many of these like night bras, and like, what do you think?
Yes, I have zero scientific evidence for this. It's just in my mind, it makes
sense. Same.
Because again, gravity is still working even at nighttime while you're asleep. And your breasts are depending on how you sleep. If you sleep on your back, they're going to go to the sides. They're going to want to hang. If you're on your stomach, they're going to get smushed. If you're on your side, they get like the bra just keeps everything where we put it. So just find a bra that you can wear at night most of the time when you can, because it can only help.
There's a lot of, you may be driving your patients home, but there's a lot of pushing back on the bras at night.
Oh, yeah.
The patients will push back on that. When can I sleep without a bra?
Yeah.
I want to sleep without a bra. And I'm like, you can't.
And I think because a lot of them, especially the larger breasted ones, bras have always been so uncomfortable for them
Sure.
that I hear all the time, as soon as I get home, I just want to take my bra off. I cannot wear the bra for a single minute more. And so I think they've gotten very used to sleeping at night without bras because bras are just so uncomfortable for them. So it's a hard transition to make to wearing something at night. But if you can, please. Your scars will thank you. Your plastic surgeon will thank you.
Yep, and there are, you have to really find something that is comfortable, because you're trying to sleep. You don't want something tugging and pulling on your skin, and it's understandable.
It's a balance.
It's understandable why there would be pushback on that.
Yeah, but now that your breasts are smaller, there's a plethora of comfortable nighttime bras that you can wear.
So, in your opinion, do you think that we're going to continue towards smaller breasts, or is this just another swing of the pendulum? And 2 years from now, we'll be talking about how everybody's going, they're waiting for them to to make 1,200 cc silicone gel implants. When are those coming?
I think I don't know that there's going to be a swing of the pendulum per se. I'm sure there will be in terms of a more curvy body types, and maybe we'll start putting in more larger implants again, going back to BBL, something like that. But I think that we're going to continue to see this trend of breast reductions, because the other thing that we're seeing are the women that want to have these really small breast reductions, but also women that don't necessarily have large breasts, but they have, and I hate this word, but saggy breasts at a young age, where their skin's really loose, the nipples are positioned low, and they've been like that since they were 16 years old. And they are now seeing that there's an opportunity out there for them to lift it. It's a lift, it's a small reduction, but it's getting them to that perky, I can wear a tank top with no bra kind of look because my nipples and my breasts aren't hanging down. So I think that's going to continue to be a thing for people that don't want large breasts, but just realize now that there's options out there for them to have that perkier breast. And as plastic surgery and everything we do gets more acceptable, more broadcast, on social media, I think that will definitely continue.
And breast reduction, we always talk about what does it cost. Now, insurance covers some of these. Obviously, I'm an out-of-network provider, so I don't take insurance. So if you want to bill your insurance, you can call them and see what it'll cover and how much they'll spend. But, I mean, typically insurance pays very little.
Yeah.
I don't know what your range is. My range for a breast reduction is between $25,000 and $35,000. And then if there's implants, it's more and all that. Yours may be different than that. I don't know.
Yeah, mine's probably like between the $14,000 and $20,000 range. Yeah.
So, and that's today. I'm in case you're listening to this podcast in 2028.
This is September of 2024.
Yes. So like things go up, the prices change, and it's always different case by case. But that's sort of the range for a straight-on breast reduction.
Right. And obviously, the larger the breasts,
there's more work.
There's
going
more
to be,
work.
it's
that being said, larger the breast, sometimes insurance covers it, but a lot of us are out of network or in the process of going out of network. So you sort of have to do, your homework and see who works for you.
And also if we're doing axillary liposuction with it or things, there can be more to it. So until you have a consultation, you really can't get what does your operation cost. This is a very hard concept for people to understand because they don't, in order to know what operation you need, there first must be an assessment and a diagnosis.
Right.
You have to decide what's going on and then what you're going to do about it and design an operation, and then you can find out what it's going to cost. But until then, you can just kind of have in your mind a price range. Whatever you're charging, it's not enough because your work's fantastic. You definitely take one for the team with some of the reductions you do. I mean,
yes.
Some of those breasts are like bigger than you. I mean, seriously, it's like incredible. And I don't know how you reduce them. They are scary. Those are very hard operations. Do not underestimate how difficult these can be. There are issues with blood supply, making just even fat necrosis of the tissue that you're moving. There's all kinds of things that can happen. So you really need an expert to get these done right.
Yeah, and that's what we do. That's what I love doing. I do a lot of them. So I was very intrigued by this article. I thought it was well timed. I thought it was well written. If you have a chance, go check it out. The New York Times article about breast reduction. And I'll be curious to see where we are in 10 years. Maybe we'll come back and revisit this and see where we are, in terms of sizes and breasts. And I'm sure we'll be looking at whole new body types.
I will be retired and cheering you on from the sidelines in 10 years. So,
Yes.
by the way, that's the that's the official announcement. So I basically have like 2,500 operations left. So if anybody wants one, this would be your time to get them.
There's a countdown.
There is a countdown going on.
And they're going
for
quick,
sure.
folks.
Yeah, they are. Well, anyway, I appreciate your discussion on breast reductions today. It's very, it is, the timing's interesting because there are a lot of bodies we just had a social media panel at the Los Angeles Society that you were fantastic on, and it included all of our experts talking about, TikTok and Instagram and television and all the different kind of media and podcasts. You were the podcast participant. And, the take-home message is that everything changes very, very constantly. And you cannot go week to week and think that things aren't going to be different. And that's why we do this podcast, so people can stay up on it. Make sure you subscribe. Make sure you check it out on YouTube. And I think that's about all we got for this one. What do you think?
I think that's it.
All right. Well, then this is the Beverly Hills Plastic Surgery Podcast coming to you from the 90210.